Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
That new wonder drug, GLP-1 drug, is just seems to be good for everything so far. Anyway, we haven't seen all of the good or all of the bad side effects of the new wonder drug. But anyway, it's interesting to notice that even for transplantation, it was an effective drug. So it's going to be interesting as time goes on, how many more beneficial results we get from GLP-1 drugs and also looking at the side effects of the drugs that we are using so commonly now, but really haven't used them for very long. But that was to me one of the most surprising positive effects of the GLP-1 drugs, having a positive effect on transplantation results as well as everything else. Mm. Okay, well, I guess we can go and start the articles. Very interesting slate of articles. As we approach uh, this era, it probably will be marked by the ever increasing amount of dementia we have in our patient populations. As we age, we have more and more dementia, whether it's the frontal lobe part that hits you early or the later dementias, and there's so many of them, and we're seeing so many people impacted by this disease entity. This article shows that around 57 million people around the world had dementia in 2021, and they expect to go up to 139 million by 2050. And there's so many different types of dementia with uh, Alzheimer's being the commonest, but Lewy body dementia being second, and then the other vascular dementias. So that the question is, how does the dementia impact? And sometimes it may be a consequence of depression, vitamin B12 deficiency, and so forth down the line, many other causes and the vascular uh, situations that decrease the supply to the brain. All of those, and of course, the early manifestations may just be um, memory loss or judgment issues or completing familiar tasks at home or so they vary and range from very simple to forgetting your keys and forgetting where you are and knowing how to get home, knowing how to get to different places. Uh, and this article talks about the 10 perhaps warning signs of dementia. Of course, one of the biggest problems, and we're still await a presentation by our dementia expert to talk to us about why we should want to find out early that you're having dementia and what are the things the family can do to get help. Uh, Whether it's difficulty in writing or reading or remembering where you are or not doing anything because sometimes the depression that's associated with it can be problematical as well. And then, of course, commonly the misplacing of things and losing the ability to remember where you are, where you're going, and all of that stuff. Uh, And then early on, sometimes just poor judgment, being susceptible to the many scams, and they have as many scams as they have people who are trying to take advantage of other people. And one of the early signs of dementia is not being sensitive to the many scams that there are. I think all of us are susceptible. It's just a matter of whether or not uh, you're taken advantage of by some of the scams, and some of the scams they have are ingenious. I mean, they just take advantage of your kindness. And then, of course, to go from changes in mood and personality. Some are very pleasant, some are frightened, some are aggressive, some are passive. But there are changes, distinct changes that make you wonder if that's the same person you've known for the 50 odd years that you've known them. And so changes in mood and personality so that the person that you know today is not the same person you knew yesterday. And all of those things can lead you to the diagnosis of dementia. And then, of course, the one of the most important things that we mentioned time and time again is the fact that you need help with managing patients with dementia in terms of getting them to be active and to be to take care of themselves. And one person alone can't do it. It takes a community really to handle a person with dementia. And is that the end of the laundry list of the changes
Yes.
or the 10 changes that they talk about? Yeah. Okay. Darryl, you had a comment.
Yeah, my comment was the difference between dementia and Alzheimer's.
Actually, Alzheimer's is the commonest of the dementias. So we have probably about 10 to 20 different types of dementia. Alzheimer's is the commonest. The Lewy body dementia is second, and then the vascular dementias come after that. But so that the commonest of all the dementias appears to be the Alzheimer's.
With Alzheimer's characterized by difficulty remembering new information.
Well, so many manifestations of Alzheimer's with it it may begin with being forgetful. It may begin with not knowing how to drive anymore, or not being a safe driver, or forgetting everything, forgetting some things. So, and it varies so much from person to person. And I think the one thing that we're looking for is to find ways once you have the diagnosis of dementia, regardless of stage, to prevent it from progressing. And that's the thing that we're really looking for. And we seem to be coming upon medications that are going to be able to delay or slow down the progression of the different types of dementia. John Buchanan?
Yes, I have some personal experience with my mother had Alzheimer's, and they gave her some medication. I could not say that it did anything, except take her money. But at that point, we're talking about maybe 10 years ago. There wasn't much out there. I mean, these Aricept was, I think, was one of them.
Yeah,
A drug that would supposedly slow it down, but
yeah.
it's a horrible disease. At least Alzheimer's is. It's like a slow motion train wreck, and you see it coming, but there's nothing you can do about it so far. Um, and I was hoping maybe we could get uh, someone to come in and talk to us about it. I was wondering if it was genetic, if it runs in families.
Yeah, it does. It is
Uh,
genetic, and Dr. Obisi-san has promised to come to talk to us about some of the new medications that may delay the progression of Alzheimer's, which we never had before. So he's going to give me a date when he can come and talk to us about many of the drugs he's working on that have seemed to delay the progression of Alzheimer's. And this is relatively new because up until recently, there's been no drugs that really delay the onset or progression of Alzheimer's. Carol, you had a question? Comment.
Okay, I too have been familiar, just like John Buchanan, and spent my money on Armistead for my mother. But what I wanted to know is, I used to go back every time I would come across different symptoms, or if it was out of the ordinary, I'd go back and read all these pamphlets of what you're supposed to do, like try to say, don't you remember, and things like that. But someone that's in the work field and you see that they have dementia, Alzheimer's, what advice should we give? I've given that example before where I saw a pastor had it, but everybody just turned a blind eye and they knew he had it, but they didn't know what to do, how to relinquish, should he give up the pastorship, and etc. And now I'm coming across someone else who I think might have, but hasn't been diagnosed, and they have two important positions. What should we do as a society? We say they shouldn't regress, get away from society and be more involved. But should we just say you should stop working, or what should we do with somebody you recognize has dementia and they're in public life?
Well, I think two of the things you can do. One is to have either the neurologist to evaluate and make a decision as to the extent of the dementia they have, or a psychiatrist, because it's important that the diagnosis be made so that they can avail themselves of the opportunities to have people help them take care of, because one person cannot take care of a person with dementia alone. Otherwise, they'll be killing themselves. And so, as John Buchanan learned, and those who have families with dementia learn, that you need to have a lot of help. You need to have places for them to go to be active, exercise, to uh, entertain or be entertained, or have social events so that take the weight off of one person. Because well, if one person tries to take care of a person with dementia, they're likely to kill themselves. So recognizing it early, getting help becomes one of the most important things you can do when you have somebody with dementia. So you can't handle it by yourself. I know John and his mother, and Carol and her mother, and others have tried to handle it themselves, but you can't do it alone. You need help because they need multifaceted areas of support. Sometimes just going out once, twice, or three times a week to social engagements will be helpful. Uh, so to me, the important thing is to get the diagnosis made, and then get help from groups that are willing to take care of your loved one. Joyce, Joyce Brentfield, you're on mute. Yeah, you're still on mute.
Sorry. I had one aunt who had dementia on my mother's side, and her son tried, and his wife tried to manage and take care of her at home, but it had become too much for them to handle, so they had to end up putting her into a facility. And it was just so sad to see a very lively person to be taken over by this disease. And when you talked about whether or not it's generic, the other sad portion of this story is that her son, who took care of her, came down with dementia. And we had to go through the same thing with him to see how such a outgoing personality and man just reduced himself to a little bit of nothing. And my question is, how do you know or distinguish the different categories of dementia?
Yeah, that's why it's important to have the neurologist or psychiatrist weigh in and actually they have a number of tests, genetic and otherwise, as well as CAT scans and MRIs that can help make the diagnosis of dementia. And once that diagnosis is made, then the kind of support that is necessary can be administered. But I think the first and most important part, as Dr. Tatum had mentioned, is to have that diagnosis made. And once that diagnosis is made, then different varieties of treatment and social support systems can be set up to help you manage it because you can't do it alone. And yes, it is genetically, there's certain forms of dementia that are inherited. And so certain gene types are more susceptible to the inherited forms of Alzheimer's than others. Catherine, you're next. I guess you haven't made a comment yet.
Thank
I
you, Dr.
was,
Callender.
Oh, Joyce,
thank you.
did you have another question?
No, I just said thank you.
Oh, okay. Catherine?
Good morning. I was thinking about this a lot. My husband had dementia, and so I was thankful that he did not have full-blown Alzheimer's during the time that I was his caregiver, but he passed away from a stroke as opposed to anything related to the dementia. But he was a twin, and his twin had Alzheimer's. And I did take him to the Indiana University Brain Center to have him tested to make sure because I didn't want to have him in a facility not knowing the whole extent of his condition. So they did verify that that is what he had. Um, I never had my husband tested. I think partly because, he didn't have the same types of symptoms, but they were twins. Sometimes I also had for myself, a blood test that they said has some bearing on dementia. And it was negative. But every time I go to the grocery store and forget something that I was supposed to go to get, I wonder if I need to go over there to IU and have my own self tested just to make sure, because they did a lot of brain scans and other things. And then there was a group of the clinicians, the social worker, those kind of folks that met with me after my brother-in-law's testing to tell me specifics about the testing and what it really involved and what I could expect and what I needed and whatnot. But he was in memory care when he passed away.
Thank you for sharing.
Mm.
Okay. John Buchanan, you had another comment.
Yes, a couple. There was a movie that came out a couple years ago, I think, called the Beekeeper, I think, and it started off with uh, the one of the stars was victim of a scam, and uh, they they got her to give them uh, her password, and They got in and took all of her money out of all of her accounts. And she was so dismayed, she committed suicide as a result. My mother, that was just a movie. My mother was victim of a scam. They uh, they called her, and this was near the earlier stages of her Alzheimer's, where they got her to give them her password. They told her that they would take care of all her bills, and
Mm.
they took money out of her bank account, and they paid a couple bills, but everything else was gone. But I
Mm.
came, I became her power of attorney, I guess, right around that time, and I was able to stop them and get the money back.
Mm.
But they were taking money directly out of her bank account.
Wow.
It's like $900 a month.
Wow.
Uh, yeah, so scams are very prevalent these days, and with the I just heard yesterday they can grab a little piece of a voice of someone and make a whole speech by that little piece of a voice that you would recognize and get money from you as a result, of that scam. Very advanced technology these days. It's frightening, to say the least. Thanks.
Yeah, thank you for sharing. It's very, very scary. Uh, Dr. Tatum.
Uh, you do not have to have dementia or Alzheimer's to be a victim of scams. They are so prevalent these days. But if you are I don't think, like John Buchanan is trying to allude to, if you're a victim of a scam, that you have dementia or Alzheimer's. I hope not. That's not what this is saying. It said you may be susceptible to scams. That doesn't necessarily mean you have dementia or Alzheimer's if you fall for one of these scams. Or am I getting that correctly?
No,
Only
you're right. You don't have to have Alzheimer's to be susceptible to a scam, but it makes it easier. That's all. But I think all of us on this Zoom are susceptible to scams if presented in the correct fashion, because what they take advantage of is your compassion, caring, and kindness. And just as John Buchanan mentioned, the next thing you know, all of your resources are gone. Darryl?
It's not always a sophisticated stick scams. And I was just reading on a Google search. I said, do dementia patients often fall victim to scams? And it says, yes, dementia patients are highly vulnerable to financial scams. So it's not just the sophisticated ones because, you know, Alzheimer's takes away some of your judgment and discretion. Some things like Publishers Clearinghouse, deceptively worded ads that suggest you are a winner, but the fine print says you may be a winner. All you have to do is buy this item, and we'll send you the $5 million Publishers Clearinghouse check. And so my mother, she believed that she was going to be a winner and that she would give the $5 million to Carol and I, and as a result, she had a basement full of Publishers Clearinghouse crap that she continued to buy because she was convinced every month she was a winner.
yeah, they were vitamins and etc. enough to fill a house. And I did
Well, but
write to them,
mm,
and I did get the money back. I didn't get the money back, but they took that bill away. It was about $8,000 worth of vitamins and etc.
Oh my
And I
goodness.
asked them how did they take advantage of an elderly person, and I was going to sue them and etc. And they later dropped the bill.
Wow.
But she did have the merchandise. I just wasn't going to pay for that stuff because they took advantage of her.
Yeah. Well, thank you for sharing because, as you mentioned, we're all vulnerable, and most of those scams take advantage of your concern about hurting somebody. And yeah,
But
Mark,
is there a way we can sue like Adderall or whatever that medicine was that they made us buy that was supposed to delay dementia? Um, I think John Buchanan and I and several others, we spent all that money trying to delay it and it was not effective. That was a scam.
yeah, well, many of the scams take advantage of your voluntariness, and they make it so that once they take the money, it's gone. Uh, Mark, you had a comment?
Yeah, just wanted to underscore a point that you made earlier. Um, you know, it, this disease is prevalent, as well as scams, but point that you made about, being surrounded by community, having more than one caretaker is also super important. Socializing and opportunities like that to be around other people, those kinds of things can help to, to quell some of the effects of this disease and some of the scams that are around, in both ways. I think being surrounded by community and tribe and our village certainly helps with these things of life.
Well, I think that any attempt to try to do it by you and your spouse is prone to failure and likely to result in damage to you as well as the rest of the family. Whereas a support by the community and the social surroundings, because it takes a village really to help with that, becomes mandatory, not optional, mandatory. Any other comment? If not, we'll go on to the next one. This is an article that was kind of surprising to me, that actually in the hospital, uh, most of the diabetes is managed by uh, giving insulin in varied doses, and that automated insulin delivery is superior to any other form of treatment of diabetes. In the hospital, you think that in the hospital, uh, you wouldn't need the automation, but actually, it's clear based upon this study that even in the hospital, the automated insulin delivery becomes the best way to do it. And this study uh, puts to rest any concerns that automated insulin delivery is not the best way of handling it. Of course, for decades, we've done it the other way. And we've talked about continuous glucose monitoring in the past. But this is the first article I've seen that talks about it, comparing it to what is actually done in the hospital and pointing out that not necessarily the continuous glucose monitoring, but the automated insulin delivery is the safest way to handle the diabetes. So this adds a new dimension to the management of diabetes in terms of pointing out how continuous glucose monitoring and automated insulin delivery may well be the best way to deal with diabetes. Any comment? Because I don't think I think Dr. Perez had talked about this at one point, and Buchanan had talked about it at one point. But this is really pointing out that this is the gold standard, and now it's becoming the gold standard. Any comments about this? Anybody who was involved other than I remember Dr. Perez has mentioned that she had been involved with patients with automated insulin delivery. And for a long while, it was not available to all levels of patients. Patients who had great insurance got it, and some patients who didn't have great insurance did not get it. And so it's becoming clearer every day that the continuous glucose monitoring and automated insulin delivery may well be the gold standard for the treatment of diabetes. Any comments or questions, any diabetics on hand who have any additional thoughts about that? Hey, you in our background, Elena. No comments? Okay. All right. Let's go to the next article then. This is an article that talks about how unexplained weight loss can unmask serious health issues like cancer and other diseases. So when you're losing weight and you're not trying to lose weight, maybe one of the first manifestations that you have some disease entity that could be cancer, could be not, but it could be something that's important enough to warrant you seeing your doctor and finding out whether or not you have a disease, because cancer is not the only disease that causes you to lose weight. Many of the metabolic diseases, thyroid and other diseases, cause you to lose weight. And I think when we talk about frailty and other things, one of the uh, best ways to recognize that something is not all right is when you suddenly find out that you've lost 10, 20 pounds without trying to. And this points out the other things that make you want to go see your doctor: fevers, fatigue, headaches, neurologic changes, and personality changes, and other things that indicate that you have something wrong. That and all of these things that they have in this list are very important triggers to let you know that something's wrong and that you need to see your doctor. Mark?
Yeah, this article, um, jokingly, this article just proves that Black people are right. Because whenever one of us loses weight, the first go-to is like, "Are you sick? Something wrong with you?" You know, without considering it could be something else. But we always assume that they're sick. So I guess this article just kind of proves that notion.
That's interesting since we're on the top list of everything that goes wrong. Black people more often than not have it. So yeah, we're right again. Dr. Statham?
The last time when my husband was losing a lot of weight, and I told the doctors about it more than one, they all looked at me and said, "Well, as long as he doesn't go by below this weight," and they looked like they acted like deer in headlights. Nobody seemed to be alarmed but me, and I was wondering why. Doctor, you tell that a patient is losing a lot of weight and you can't understand why. Can you give you an answer? And I guess they couldn't give me an answer, but nobody seemed to be alarmed of the weight loss.
Well, I should have been. Well, you know, one of the things that we learned some time ago doing some studies was that because the doctor doesn't take advantage of these early signs, doesn't mean that that they aren't important, because uh, the patient is often right even when the doctor is wrong. So that yes, that's a sign that something's serious, and if the doctors aren't alarmed, uh, they should be. And I think most of the studies that I've done indicate that if you think something's wrong with you, you're probably right. And if that doctor isn't able to find it, well, maybe you need to find another one who will. But anyway, your point is a good one that whether the doctor likes it or not, uh, progressive weight loss is a sign of disease that is uncontrolled. Darryl?
Well, more specifically, is loss of appetite an indicator of illness?
Yes, yes, it is. Yes, loss of appetite is one of the early manifestations of illness, and it's interesting as you look at older people as they approach the end of life. They sometimes one of the first manifestations is they stop eating, and so when you have a loss of appetite, yes, that's a sign that something's wrong. But whether it's a loss of appetite for solid foods or liquids or whatever, it's an early satiety, for example, meaning that you eat a little bit and you're full. That's another sign that things are not right. Any other comments about this great article? Pearl?
Yes, I just wanted to say I'm listening to what everyone is saying, but as someone uh, who has been overweight most of their life, and in the last year, I have probably lost close to 100 pounds. But I've been going to the doctor regularly, and they're just saying my doctor's just saying everything is fine. I've just lost weight. I haven't lost my appetite or anything like that. But all of a sudden, I've been kind of overweight most of my life and been trying to lose weight most of my life. And all of a sudden, I just started losing.
Well,
And according to my doctor, everything's fine. In fact, the doctor actually said my kidney disease has really gotten better since I have lost the weight.
wonderful. That's great news. And so if your doctor thoroughly evaluates all of your conditions and identifies that, hey, you are losing weight and you're doing well, your health is all of the health parameters are improving, then that's wonderful. Yeah, that's good news.
Mm. Well, thank you. I do feel better.
Good, good. Because it's healthier to not be overweight. As Darryl has said time after time after time, that obesity is not the way to go. So getting healthier in your case is great. Okay, guess we'll go to the next article. This is an article that is probably of more importance to doctors than it is to patients. But right now, one of the biggest problems we have is that because of the way we have used antibiotics, most of the bacteria are becoming resistant to the antibiotics. And so for that reason, it's important for the doctors not to use antibiotics inappropriately. And when they say that, they mean that, you know, uh, antibiotics are not the treatment for viruses. So when people give you antibiotics for a virus, that's misuse. And what happens if you use antibiotics inappropriately, the bacteria become resistant. And so we get to the point where none of the antibiotics that we use are effective anymore. And therefore, it's important for doctors to be reluctant to use antibiotics without a good reason. And if you don't have a bacterial infection, then there's no reason to use antibiotics. And so the misuse of antibiotics has become something that results in uh, our ability to use antibiotics to knock out bacteria becomes less effective. And then, of course, the fact that they even use antibiotics for uh, for animals inappropriately also causes the emergence of resistance bacteria that are resistant to traditional antibiotics. So this is a practice that is harming us more than it is helping us, and we've got to do better. Darryl?
Okay, as you mentioned, antibiotic resistance from eating meat. And it starts when, uh, okay, it doesn't matter what the animal is, if it's pork, if it's cattle, if it's chicken, their natural diet is not corn, but they feed them corn because it's cheap, makes them sick, so they give them antibiotics. And so then it spreads to humans because there's resistant bacteria in the livestock. The animals become antibiotic resistant. There's horizontal gene transfer where now those resistance genes are spread across different species and it's shared to humans. And then there's a trace amount of the antibiotics in the food that can disrupt the human gut microbiome. So, if you're concerned about antimicrobial resistance, um, the thing to do is if you're going to eat meat, stop eating conventional meat because the conventional meat has antibiotics. So if you're going to eat meat, you're better off eating organic, grass fed meat that doesn't have antibiotics and is grass fed.
Thank you for sharing. Any other comments about this process that is making the emergence of uh, bacteria that are resistant to antibiotics becoming more and more common and making us less able to fight off infection when we get it? Oh, of course, they also emphasize something that we often underappreciate, and that is that once you start a course of antibiotics, it is expected that you complete it. So if the doctor gives you 10 pills and you only take 5 pills, uh, you're not doing yourself or anybody else any favor because you're not completely eradicating the bacteria uh, and the best thing to do is if the doctor gives you pills and you're supposed to take it for 7 days, take it for 7 days because otherwise the infection will be inadequately treated and it will result in the emergence of uh, resistant bacteria. Any other comments or questions about this topic, which is becoming more and more a concern because we're inappropriately using antibiotics more and more every day? Next article, please. Well, this is this is an article that is appropriate because as of this year, uh, you can be you have to prove that you're too sick to work in order to be covered by Medicaid. And this Medicaid work requirements is something that is part of uh, Donald Trump's beautiful bill. And many places are protesting it because they don't think you really need to document that you're too sick to work. But according to the new Medicaid requirement, you have to document that you're too sick to work. If not, you lose your eligibility for Medicaid. And this is something that became effective January of this year and will persist under the beautiful Trump law that requires uh, you have to prove that you can't work or prove that you're doing community service. Otherwise, you become no longer eligible for Medicaid. And that's something that many people are protesting. And many are not aware of this new requirement for Medicaid, but they're claiming that too many people who are on Medicaid just sit home and do nothing. And so they're going to require that you prove that you're too sick to work. And that's something that's new. They've said that about us for quite a while, by the way. But President Trump has now actually put it into the law. So you have to actually prove that you're too sick to work. And if not, you aren't eligible for Medicaid, which is kind of frightening that they would actually do that. Any comment on this new Trump law that is effective now?
Dr. Callender, do they say how you're going to prove that you can't work?
Yeah,
What
yeah.
do you have to do?
If you are too frail, if you have a diagnosis of frailty, or if you are doing community service and you can document that you spend a lot of time doing community service, then you can become eligible. But if you can't do that, then you lose your Medicaid eligibility. And not too many people have tested it, but this is something that is frightening. Darryl?
Yeah, well, this is extreme cruelty, and it's founded in racism. With the expectation, the racist expectation, is that Medicaid is welfare, and black people are they're getting paid to do nothing, and so
Right,
let's make sure that they're able to work. Without realizing that the people it mainly affects are white people.
right.
But then when the white people can't get their benefits, then they're trained through social media and some broadcast television like Fox News. They're trained to say government is a problem, hate the government, and vote for Republicans again.
Thank you for sharing. Very good. Put it in common language to show the racist aspect of this, which some people may not appreciate. Okay, let's go to the next. Oh, Catherine?
I was just going to say that's why Bishop Barber, William Barber, is advancing the poor people's campaign again because he realizes that it's not a black thing, it's a poor thing that they're trying to do. And he's trying to coalesce all of those people, whether they're black, white, or whatever color, to understand that this is not against a race, it is against poor people, period.
Yeah, it's true. Thank you for sharing that important point. Okay, now this is an article that is kind of a little addressed to the people from France because this drug is more commonly used in the UK and France than it is in the United States because fluoroquinolones is very common in the United States, whereas it's less common outside. And what this article is showing is that the fluoroquinolones in older men, older than 75 years, uh, are safer than all the other drugs. But in the United States, for the most part, we use the fluoroquinolone drugs, and and we would continue to do it because this article points out that that's the safer combination. So while in the UK and France and other areas in Europe, this is an issue. It's probably not an issue for us because we don't use the cotrimoxazole antibiotics. We use the fluoroquinolone antibiotics more. So, but it's an article that helps you appreciate the fact that this is the antibiotic of choice. Now,
Yeah. Of course, the idea is that men older than 75 are prone to UTIs, urinary tract infections. And that's usually because in your 70s, your pelvic floor weakens. And when your pelvic floor weakens, you're more likely to be able to completely empty your bladder. And so if you can't empty it completely, emptying it flushes out bacteria. Bacteria remains and causes the UTIs. And I appreciate the drugs, but strengthening the pelvic floor is pretty important. And I think women are more familiar with it than men are. But it's a simple thing that men can do once you get in your 70s or even before is do the Kegel exercises to strengthen the pelvic floor. And any women out there that do the Kegel exercises that can explain to men what to do?
well, I think you hit on a very important point because most men don't realize that exercising the pelvis becomes an important part of the aging process, whereas for women, that is something that is shared. John Buchanan?
One of the benefits of yoga, also they focus a portion of the exercise routine on pelvic floor muscles.
Okay, well, I can share an exercise that I do when I get up every morning. As soon as I get up, um, empty my bladder, of course, sit in a chair, back straight, feet about shoulder width apart, and the pelvic floor muscles are the same ones that you use to stop the flow of urine or to stifle flatulence. And so you find those muscles, and for a 4 second count, you squeeze the pelvic floor muscles while inhaling through your nose. And then slowly exhale. Repeat the process about 12 times. That'll cover about a 2 minute period. And that's one of the Kegel exercises that can strengthen the pelvic floor.
Thank you for sharing. Any other comments? Okay, well, let's go to the next article, please. This is an interesting article because we talk about skin cancers being more common in white people, and we talk about melanomas occurring in people of all ethnic groups, but it appears that there's an increased incidence of a malignant melanoma in men and older people, even though Bob Marley died of malignant melanoma. And we have Black people who died from malignant melanoma of the scalp and hands and toes and feet. So, but it's, the data supports the fact that malignant melanoma is more common in older people and in men more so than women. Because skin cancer is less common with people who have color, we tend not to appreciate the importance of the melanoma. but we do have it occurring in people of all complexions. Any comments about skin cancer? Because we know that one of the greatest associations of skin cancers with people who don't have melanin and people who get out in the sun and don't protect the skin. And of course, we people of color can burn just like anybody else if we don't protect our skin from the sun and the ultraviolet rays. But this is skin cancer is one disease which is less common in blacks than it is in whites. Any comments or questions about skin cancers? If not, let's go to the next article, please. This is kind of surprising to me, this article that talks about cycling being linked to atrial fibrillation and atrial flutter. I thought cycling was great, and I think it's a good exercise. But the fact that it is in middle-aged men, it's associated with heart disease, atrial flutter and fibrillation is surprising to me. I don't know many of you still do cycling, but Darryl, you had a comment?
Yeah, this article kind of hit home because I've been an avid cyclist through the years in my middle age. Um, I even did a triathlon and I did a century bike race, which is 100 miles. And
Mm.
I'm an AFib patient. So I suppose anecdotally, this article rings very true for me. And
Right.
so now I've got my bikes that are hung up on these racks in the garage, and I walk past them, and I don't even want to ride them anymore. I guess I'll just sell them.
Uh, Mark?
Yeah, so I'm thinking it. I don't think it's an all or nothing proposition. When I hear cycling, specifically the word cycling, I think of what Darryl was talking about. Where those who are doing a lot, they're cycling 100 miles and so forth. I in my mind, I'm thinking that this is different. That would be different from someone who is casually riding a bike, which I think still has good health benefits, or even those who go to the gym and use the bike there, the stationary bike at the gym. I would think that kind of cycling is probably still useful, but I think to the article, unless it could tell me differently, I don't think they're saying like regular exercise is bad for you because I don't think that's a good correlation. I think they're saying, the high intensity, high impact cycling is probably not great. But that's just what my mind is telling me. Again, unless the article or science can tell me differently.
Well,
Yeah,
it's
and the key.
actually it's only saying that it exposes you to the risk of atrial flutter or atrial fibrillation. So it's alerting you to that potential, and so if you're, but your statements relative to the volume of the exercise is very accurate in terms of this article. Catherine?
I was gonna say, yeah, I think it's what you're doing in terms of volume. Because after I had my triple bypass, one of the exercises that I had to do in physical therapy was a stationary bicycle and also some other equipment that was similar to a bicycle. So um, I know that that was something that they had as part of my protocol. I also know that my dad was a cyclist. He did like long bicycle rides to raise money for some civil rights activities that our national church does. And he rode from Indianapolis to Tulsa and from Kansas City to Oklahoma City, uh, going from state line to state line, and different people from different churches would join him during their trip across their state just to, but he was 66 when he started doing that and probably 70 when he stopped.
Well, it's interesting that it is not saying that it's not healthy. It's saying that it's associated with increased incidence of atrial fibrillation and flutter, uh, particularly the high volume. And of course, what your father was doing is obviously high volume. Yeah. So,
Good morning. Sorry, I don't know the little thing to put my hand up. But um, I'm Gina Rao joining late today. I apologize. But
welcome. Good to see you, Gina.
hi. Um, it seems to be that more and more men in my small circle of family and friends seem to be, really intent on high intensity exercising into their 70s. And, um, there's the correlation now that you're talking about with high intensity exercise and cycling. I have three people, two friends, one relative, in their late 60s and as they were turning 70, who then developed atrial fib.
Mm.
And one of them is a hockey player who would get up at 4 in the morning to be at his hockey game every morning. And says, he's been doing this for years. And the other two, one is a cyclist, the other one is someone who gets up at 5 in the morning to go swimming in Jamaica. And um, I don't know if there's some advice you want to give people, Dr. Callender, who are in that age group about the level of exercise that they want to continue to achieve. Or is there advice about how to slow down healthily?
Well, I guess I haven't seen. This is the first article I've seen that associates cycling with atrial flutter and atrial fibrillation, and it's kind of a new finding, and so it's important to share it. And then they emphasize the high volume exercise. So I think the article speaks for itself. So I
Yeah.
think be so informed. Uh, what is Mark Tatum's advice? Never exercise with your ego or competition. Well, that seems like all we ever do anyway. But anyway, and now,
Yeah, we had an article earlier this year that said that marathoners and ultra marathoners were prone to AFib and
yeah,
arrhythmia.
yeah.
So I mean, I can tell you that the effort that you spend, if it's an endurance exercise, whether it's whatever it is, swimming, hockey, running, cycling, you go overboard, and it's like what they say, mess around and find out.
Yes, my
Well,
one friend who did a long, long bicycling ride, um, he ended up having to have a heart valve replaced.
mm,
So there's some extremes that I
yeah.
know of.
Well, anyway, it's information, so we have to use it appropriately. And this is talking about the high volume, not the person who just rides a bike occasionally or intermittently. When they talk about high volume, which most people would have thought would be okay, but atrial fibrillation has its consequences that are
Yes,
not so hot. So that
right.
be aware. So this is a opportunity to be knowledgeable about it. It's new stuff, just published May of this year. So, okay, let's go to the next article. Oh, this is an interesting article. One of the things that, we had Dr. Coleman talk to us about prostate cancer and prostate. And one of the things that we recognize is that people who get the diagnosis of prostate cancer usually die of diseases other than the prostate. And so that many of the prostate cancers are not things that will kill you in your lifetime, but the treatment of it becomes important. But you do have the category of prostate cancers that are with you for 10, 20, and 30 years. And they want to label that differently from the other cancers. And this is a debate that I think the medical field can engage itself with. But I think it's also important to recognize that getting the PSA uh, is a way of getting an early diagnosis of prostate cancer and getting it treated before it becomes very invasive and lethal. And so that's what I think this article is all about. And I think the debate about whether they should reclassify it is, and to me, is a play on words, but it's worth discussing. Darryl?
Yeah, just a caution for men before you get blood work for your annual physical or wellness exam. A recent ejaculation can raise your PSA temporarily. So you want to make sure that you don't get lucky or take matters in hand before you get your annual exam.
Okay. All right. All right. Any other comments about it? I think one of the things that was discussed is that black men have more prostatic hypertrophy and prostate cancer than whites do. So it becomes more of an issue for for black men than it becomes an issue for white men. John Buchanan.
Yeah, my father and my son both had prostate cancer and were treated, even though differently. Um, Neither one of them had a fatal case. But my doctor, for some reason, seems to be reluctant for some reason to give me the PSA. I guess, I mean, I'm 76. I think they're saying that I've heard it. I don't know if it's true that all men are going to get prostate cancer at a certain point, and whether it's going to
All
be
men are going
serious
to get
enough to.
prostatic disease. It doesn't have to be
Okay,
prostatic cancer. You
okay,
have benign prostatic hypertrophy, which impacts your ability to urinate as well. So that all men, close to 100% of men, will develop prostate disease, whether it's the hypertrophy or cancer. So that's a
okay,
fact. But uh, one of the things that prompted the decrease in the reliance on PSA, particularly in whites, was the fact that having a high PSA may result in prostatic biopsy, which is associated with some complications. And so, because of that, they felt that getting a PSA would result in you likely having a biopsy which would cause problems, and therefore they decided that it's not an for the older white men. Uh, most of virtually all of the black urologists disagree, though. They feel that, and then of course you brought in an age issue. because some people feel that after the age of 80, the PSA is not as helpful. But nowadays, when you have the MRI of the prostate, in addition to the PSA, you can do an MRI and look at the prostate and decide whether or not the PSA means that you have prostate cancer or not. And so that's an advantage that we have now that we didn't have before. We didn't have the MRI of the prostate, which you could use as an additional test to look at the prostate itself and decide whether it's large, small, or had cancer within it or not. And so this then is why, particularly the white urologists, are reluctant to get PSA, particularly in patients over 70.
And my doctor's African American. It's just it puzzled me that
Well,
he questioned
yeah,
the
well, candidates
the
to flame.
idea of having a PSA.
Yeah, but that is the reason why there was a reluctance about the PSAs.
Dr.
So
Callender,
is the MRI expensive to do? Is that a big deal?
No, it's not expensive. Your insurance covers it.
so I was
Yeah.
going to ask if anyone knows, um, how long, generally speaking, does it take for the complication of bone cancer, metastasizing to the bones, from prostate cancer? How long does that process take in general?
It
Because
actually,
that is something you want to avoid.
well, it depends upon the invasiveness of the cancer, because you have some prostate cancers that are very, very invasive, and they go outside of the prostate capsule early on. And you have some cancers that are not invasive, and so they stay within the prostate. So it's hard to determine unless you get a biopsy to find out whether it's the invasive type or the non-invasive type. But that is an issue, Margin. But I think the only way you know is by getting a biopsy.
Right. Because pain associated with the metastasis to the bone is something everyone wants to avoid. And a person that has prostate cancer in his 70s could very well have other illnesses as well. And I think it really is important for people to start getting their PSA tests at an appropriate time so you can, predict how to avoid, how to treat, how to make decisions, whether or not you have prostate cancer diagnosis. So that's my 2 cents.
And Dr. Coleman had mentioned that if you have a PSA that's over 4, then it's a concern. If it's under 4, it's usually not a concern. So that was her what she shared with us in that talk a couple of
Ah,
weeks. Darryl?
I'm sorry, I just have to make another plug for veganism because if you don't eat meat and you control or minimize the amount of sugar intake, you don't smoke, no alcohol, chances are your PSA levels will be low and you minimize your chance of getting prostate cancer.
Thanks for sharing, Darryl. Okay, let's go to the next article. Oh, this is an interesting article for those who actually have to have radical prostatectomy, which is the treatment of choice for prostatic cancer if you don't take radiation and androgen deprivation therapy is part of the way in which prostate cancer is treated. And apparently this is improving the success of prostatectomy. Nowadays with the robotic surgery, many people are opting for radical prostatectomy as treatment of choice rather than radiation. But the combination of the androgen deprivation therapy before and after radical prostatectomy has reduced the risk for distant metastasis and improved 5-year metastasis-free survival. So those men who develop prostate cancer have to make a decision about whether to have the prostatectomy or the radiotherapy. Each has its own uh, complications as well as its own merits. Okay, let's go to the next article. This is an interesting article that details the way in which herbs can help uh, manage lower urinary tract system symptoms linked to benign prostatic hypertrophy or hyperplasia. As we had mentioned, 100% of men are going to get BPH, whether it's the hyperplasia or the cancer, and therefore they will have problems, as Darryl has mentioned before, with increased urinary symptoms that they have to get up at night to urinate and other things. And there are herbs that they detail. Some are helpful and some are not. And this article goes through all of the different herbal remedies and identifies that some are of value. It goes through at least 5 or 6 of them. And the bottom line is that if you're going to take herbs, I think it's important to let your doctor know whatever herbs you're on. And then the pros and cons of whether they're going to help with the urinary symptoms varies from person to person, Rich. And it's hard to decide which herb is desirable for you and undesirable for somebody else. Darryl?
Yeah, palmetto does not cause erectile dysfunction for the majority of users, but if you experience erectile dysfunction or loss of libido, considering stopping it.
Important information to keep in mind. You can see the other ones that they enumerate. I'd never heard of African cherry or beta testosterone, but these may or may not be of help. But whatever herb you use, just if you use it, just let your doctor know that you're using it so you can evaluate the consequences of it. Some of the herbs that they have, they don't articulate what's in them. And for that reason, it becomes important to, if you're going to take them, to at least let your doctor know about it so he can look into them and decide the pros and cons of how they would benefit you or not. And if you use them and it helps, fine. If it doesn't help, then you need not to use it. Any questions or comments about the use of herbal medicines for men and urinary symptoms? Okay, let's go to the next article. This is an interesting observation that maternal cardiac disease is tied to your child's congenital heart disease. We often wondered why some children would have congenital heart disease and some wouldn't. And this article is suggesting that a lot of it relates to the management of the cardiac disease of the mother and suggests that if the management of the mother's heart disease is appropriate, that you might decrease the congenital heart disease. I think that remains to be seen, but this article is suggesting that the association is there. Although many of these studies done outside the United States is still food for thought. And certainly it's clear that the mother's heart disease should be managed appropriately before they deliver. Darryl?
Yeah, I have a friend who's who's an OBGYN nurse, and she says that pregnant women are increasingly more obese with more heart disease, and the trend is that they say in the United States, the percentage of women entering pregnancy with obesity has steadily climbed to roughly 1/3 of all pregnancies, which is, you're looking at women generally in their 20s, childbearing ages, and a third of the women are in obesity with heart problems, and they're passing that on to offspring. So, we have an extreme obesity problem in the United States. If you're from other countries, the question is, how do you spot an American? They're the fat ones. And we really ought to stop glorifying fatness and obesity and call it what it is and stop the trend, because the trend is killing us. And especially with black people, we're the fattest of the fatted when it comes to Americans.
So true, so true. And actually, we consider obesity as a disease, but yet on television we tend to glorify it, which is a paradox, right? A paradox. Okay, let's go to the next article. This is an article that was surprising to me. And just as the article that showed the reliance on automated insulin was positive, this also shows that the use of in-hospital statin drugs is associated with a lower in-hospital mortality, which is interesting because we still don't say that people over 65 should be on statins. But here we are saying that the mortality of in-hospital patients is improved if the patients who are admitted placed on statins. So it's interesting dichotomy of data that it remains to be substantiated. This is one of the first studies that has actually looked at the difference between the mortality in those patients who are actually in the hospital on statins and those who aren't. We know that statins give you better cholesterol levels and they decrease the incidence of stroke and heart attacks and so forth and so on, and lowers the cholesterol level, so that there is merit to the understanding of the value of the use of statins. But this is the first article I've seen that demonstrated it in the hospital. So, any comments or questions about the role of statins in decreasing stroke, hypertension, increasing stroke, decreasing heart attacks, and so forth?
I just find it interesting because you don't generally think of adding a statin, which is sort of a chronically taken medication in general, um, of adding a statin to your hospital meds.
Hmm,
Um, is
well,
this is this
hmm.
referring to people who are already on it and continuing it, or is it talking about starting on
It,
a
it,
statin on admission?
it's both. It's both, and that's what's interesting about the study because, as you say, of course, there was a time when virtually all cardiologists recommended aspirin and statins. Of course, many studies since then have rebelled against the use of aspirin in people who don't have already have hypertension or other cardiovascular diseases. But they haven't really taken a position on the statins. And so, as a consequence, there are many people who are on statins. But the issue you raise is whether this is regards people who are already on statins or people who have never been on statins before, but suddenly are started on statins. And they have not clarified the distinction, but the impression is that this is for all comers, that those people who weren't on statins before and those people who were on statins before, that the in-hospital mortality was decreased if they were started on statins during the hospitalization. So it's an interesting article.
Yeah.
In the long term, whether this will pan out is another question. Does that address the question that you asked, Gina?
Yes, yes, yes. Thank you. It's very interesting. You're right.
Okay, let's go to the next one. Vitamin C may be a key to a healthier brain as you age. Uh, there was a day in which it's interesting. Linus Pauling won 2 Nobel Prizes. One was for his work with vitamin C, which uh, demonstrated that vitamin C helps you fight off colds and was very good for you. And this is an article now that was done in Japan that shows that vitamin C levels support healthy brain aging. Uh, uh, it's an interesting idea. And they studied 2,000 adults in Japan with MRI and blood plasma levels. And those with higher vitamin C levels had larger gray matter volume. And so, therefore, they had healthier brains. So leads to the conclusion, although it doesn't necessarily say so, that if you have an adequate vitamin C level, that your brain is going to be healthier. And so for those of you who are vitamin C enthusiasts, you might think that vitamin C is the way to go. Darryl, what are your thoughts?
Yeah, it's not just citrus fruits that have the vitamin C, it's the brightly colored produce. And so yellow bell peppers, um, they're 100 milligrams of vitamin C per serving compared to oranges, 70. You got guavas and papayas. Um, Standard serving 165 compared to oranges at 70. Strawberries 90 compared to 70. Kiwi fruit 70, the same as oranges. And the cruciferous vegetables like broccoli, kale, Brussels sprouts, they offer 50 to 90 milligrams per cup. So it's not just oranges. There's a great variety of vitamin C rich foods.
Thank you for sharing. Thank you for sharing.
One question. What difference does it make when you cook the vegetables? Are you talking about raw cruciferous vegetables?
Did you hear the question, Darryl? I didn't.
Yeah, good question. Do you lose the vitamin C once you cook it, or is it better raw? So I don't know. I'm going to ask Google. Yeah, you lose it when you cook. So if you want to get the full value of it, eat it raw. So if it's raw broccoli as opposed to cooked broccoli, do the raw. But of course, things like papaya, quick kiwi fruit, strawberries, those are very easily digestible raw.
Thank you.
Okay, I guess that'll be the last article for the day. Thank you, folks, for joining us, and God be with you till we meet again next week. Any closing comments, Dr. Tatum and John Buchanan?
No, just thank you again for all you do.
Okay, well, thank you all for joining us, and a great session, and look forward to seeing you, God willing, next Thursday.